Well. It's time of the year where the health insurance companies submit their rate increase. Here it is, August the 15th, 2017. And apparently, according to healthcare.gov, we can view all the ACA compliant plan rate reviews. According to healthcare.gov, Blue Cross Blue Shield, the HMO individual, they're seeking a 23.93% rate increase for 2018, which is lower than last year's rate increase. And then the highest rate increase in the state of Texas for ACA compliant plans is Crestus Health Plan CHP. I believe that's Children's Health Plan. They're seeking a 53.13% rate increase for 2018. The next one below that is Aetna Small Employer Group, 36.41%. And then Scott & White at 36.24% rate increase. Now, in the state of Texas, ever since Obamacare kicked in, the highest rate increase of an insurance company since Obamacare kicked in, because you remember that kicked in 2014, was Allegan Insurance Company, which now Blue Cross Blue Shield owns and operates now. They bought them out this year. On May the 10th, 2016, for the 2017 calendar, they seeked a 80.11% rate increase, and they were approved for a 71% rate increase. And then Humana, they seeked a 62.85% rate increase, and they got it. And then Blue Cross Blue Shield last year, they seeked a 58.60% rate increase, and they were approved for 48.11% rate increase. So sometimes they do get the rate increase, what they ask for. Sometimes it's a little bit more, sometimes it's a little bit less, I notice. But in reality, especially with Blue Cross Blue Shield, I think their rate increases are really unjustified. Now, I read the information of the 2018 rate increase. Supposedly, they claim that they only made $8 million on the individual market here in Texas on the Obamacare plan, supposedly, which I don't believe that. I believe they made more than that, because Blue Cross Blue Shield of Texas is owned and operated by Healthcare Service Corporation, which owns 5 Blue Crosses: Texas, Oklahoma, New Mexico, Illinois, and Montana. And Healthcare Service Corporation and these Blue Crosses are non-for-profit tax-exempt companies, which means they don't pay 1 cent in property tax nor 1 cent in federal income taxes. And according to the Texas Department of Insurance, they have a net surplus of $9.5 billion as of December 2016. $9.5 billion with a B dollars and net surplus extra cash. So in reality, for Blue Cross, their rate increases are not really justified. Because in theory, if they're tax-exempt non-for-profit company, their rate increases should be lower and the premium should be lower versus in line or above for-profit health insurance companies. But I will post a link where you can view all the by state. Now, if you want to look at the 2018 effective date, you need to change that, and it will select all the rate increases for ACA compliant plans on healthcare.gov. I'll post a direct link where you can do that. But I believe that they made more money than what they say they're making. To me, they made more than $8 million. I'm going to do a video about that in a minute too. So if you have any questions, comments, please post them below. But if you do have Blue Cross Blue Shield HMO individual, because they don't have no more individual PPO plans anymore, they're seeking a 23% rate increase for 2018. So chances are they are going to get it, because they have to submit that through the federal government, and as well, they have to submit that information to the state of Texas too, to the Department of Insurance. I think all these rate increases from these insurance companies, I think they're phony. I think it's some made up numbers that they make up, and I don't think it's really true at all. Because the profits will keep going up. Now, if insurance companies' profits keep going up, well, how can they justify a rate increase? Because the lie that they tell is we must have more money to pay out claims due to the rising cost of healthcare. And they claim that losing money. Well, if they're losing money, why are they showing a whole bunch of profit? And for instance, in Healthcare Service Corporation, Blue Cross Blue Shield, they're non-for-profit, but yet their net surplus is keep going higher and higher and higher. And they don't have investors because they're not a public traded company. So that money where they keep building up from comes from members' pockets in reality. So I'll post a link below where you can view it.